So what can you do about these lip lines that are around the upper parts of our lips? They're quite pesky, and some people do not want to have lip filler around this area. They don't want to have lip filler in their juicy part of their lips. And what is the latest treatments that are there? When clients come to me and I do an assessment on their face, one of the things that most of my clients say to me, I hate these lines that are around my lips. So they're called smoker's lines, barcode lines. Even though you may not necessarily be a smoker, as we go down the path of life, these lines on the upper parts of our lips become more obvious. Starting off with fine lines, and then they become more dynamic as time goes on. We use our lips all the time for drinking out of a cup, drinking out of a straw, kissing, and so on. And those dynamic lines become more grooves. So what can we do to soften them? So some people ask me to know what have I had done, and I've had a tiny bit of lip filler on the vermilion border, blebs in the little lines to balance out those deeper grooves that I have along here. I've also had a little bit of Botox done recently to stop me from pursing my lips like so. The downside of that is that you're inclined to dribble a little bit when you're having your coffee or if you're sucking through a straw. And I loved all of them. But what is now superseding all of those treatments is new polynucleotides for around this area here. It's actually not specific for around this area here. It's used for around the eye, so it's very formulated in such a way that it's not going to distort your upper lip or your lower lip or the lip. Some clients have had some of those, they've had not the others, and they are very interested now in the polynucleotide treatment that is done in tiny blebs all around your mouth. It's done in 3 treatments, 2 weeks apart, and that stimulates the upper lip cells in that area and the bottom part as well, whereby it wakes up your cell to do what they always did. It also stimulates collagen and elastin, so it helps to smooth out this area here, and I for one have found it absolutely marvellous. Now be aware that the full extent of this polynucleotide treatment takes 5 to 7 months to work, so it's like planting a seed, watering it and waiting for it to grow. It appears there's nothing happening, but it is, and it's happening very, very slowly. So what else can you do to soften these lines? So even though I'm not a dermatologist, another more effective ingredient is to look for topical products in the form of vitamin A, which is called retinol, which supports the formation of collagen and cell turnover. It comes in 2 main forms, tretinoin, which is this, I buy it in Spain, or retinol, which is this, and I usually use it in the night time. So the regular use of these accelerates the cell turnover, diminishing the appearance of fine lines and improving the skin texture. If you're not going overseas, find a practitioner who does, who will give you a prescription for tretinoin, and you can buy it on prescription here in Ireland. Subtle lip fillers like Bellatero Balance help to hydrate the lips, and that gives that volume back to the lips, and it accelerates the cell turnover as well. And a daily application of a broad spectrum sunscreen protects the skin from further UV damage and slowing down the aging process. I use a Lumiere's Clear Shield. Extra to that, I use vitamin C serum, incorporating antioxidant-rich skincare products. So with vitamin C, can help to combat the free radical damage and support skin health. So there you have it. I hope that helps. So if you're not interested in Botox to help to paralyze the dynamic lines up here, if you're not interested in lip filler along the vermilion border, if you're not interested in lip filler in the body and the juicy part of our lip to reinflate the lip again, if you're not interested in Bellatero Balance to fill out those lines in tiny little blebs into those lines, and if you're not interested in using the topical creams, well then the last thing you've got is polynucleotides, which can be injected in tiny blebs all around here for 3 treatments, usually 2 weeks apart, and then you become 6 monthly. Do something, because those lines are only going to get more and more etched and deep grooves if you don't do something about it. So I've tried them all, and at the moment I'm finding the polynucleotides the best right now.